Welcome to this session on Leading and Organizing in Action, Motivating Vision. I'm Kim McCoy, Senior Program Manager with Stratus Health. Thanks for joining me. Our objectives for this session are to explain why narrative matters in organizing coalitions, to understand how the leadership practice of narrative works, to identify opportunities to apply the skill of narrative, and to highlight best practices of narrative use. As a theory of change, organizing is about equipping people with the power to make change. It takes up three core questions. First, people. Who are our people? What challenges are we facing? And what is our vision for a different future? Second is power. What resources do we already have to achieve this vision for the future? And what resources do we need? And third, we talk about change. How will we mobilize and deploy our resources to achieve our vision? The first question an organizer asks is not what is the problem, but who are our people? Organizing starts with people because it focuses on developing and applying the leadership skills of those with the problem so they can mobilize their own resources to solve that problem and sustain the solution. In coalitions, multiple constituencies or groups of people who work together toward their own goals combine forces and stand together to achieve an even broader shared purpose. To recruit and retain the people we need to create our power for change, we use our stories or narrative to illustrate why people should care about and join our mission. Narrative plays a foundational role in engaging and encouraging others to support and join our coalition. Narrative is the skill of creating a shared story around our common values to motivate others to join us in action. It involves three core components: personal stories that illustrate our own values, or the story of self; collective stories that illustrate shared values, the story of us; and stories that illustrate both the challenges a group faces and the hopeful actions groups can take to address those challenges. This is the story of now. The shared values expressed in narratives form the basis of our motivating visions and our calls to action. Narrative offers a framework for developing a clear and collective purpose and creates a values-based culture that underpins group efforts. It invites and inspires new volunteers to join in action and leverages intrinsic motivation to ensure involvement on an ongoing basis. It reminds people of their core values and the compelling urgency to act, which then reinforces decision-making. Narrative reminds team members of what unites them and how together they can make a difference. The story of self is used by leaders to courageously and authentically describe and share personal experiences, such as trials navigating the healthcare system or stories about loved ones who were harmed in the course of their care. They tell stories about patients whose lives could have been saved by population health efforts, whose families went bankrupt paying for care, or whose surviving caregivers suffered secondary health problems. They share personal yet universal moments of grief and loss, and how those moments transformed the storytellers as people and as professionals. In the story of us, leaders tell stories about their community or their coalition and its members. They share stories of hope in which diverse stakeholders came together to care for each other, to overcome community-wide crises, to sacrifice individual profit for collective prosperity. They paint pictures of the urgent challenges, describing what chronic disease looks like for patients, families, and their communities right now, and instances when those around the table work together to innovate and improve their community's health. In the story of now, coalition leaders engage others around the table to identify a motivating vision, a picture of a community that keeps all citizens healthy in the least invasive, lowest cost, most efficient, highest quality way possible. where patients are less likely to require emergency room visits and hospitalizations, saving millions that could be reinvested in community health. They invite others to imagine specific ways for everyone, providers, patients, and community members, to do their part in developing a new system for how healthcare is delivered, used, and paid for, starting right here, right now, with the coalition itself. In using narrative, coalition members view their leadership and team differently. With an emphasis on values, narrative provides a way to connect on equal footing with other stakeholder groups. As one leader put it, different people are motivated to participate for a range of reasons: a belief in the triple aim, a market motivation, a population health mandate. But it is the use of narrative that connects us around a shared moral purpose, and everyone is united by that. In just a few moments, narrative establishes a foundation on which to lead by example, collaborate with others, and discover common purpose and vision to take action. The story of self is how individual leaders learn to access their own moral resources and courage to be vulnerable, to make choices in the face of urgent challenges. As healthcare leaders, this piece is most often missing when we describe our strategic plans or actions. Think about it. When is the last time you shared your story of self when describing your work to someone? This story of self is incredibly important in establishing an authentic relationship with our potential coalition partners. It connects leaders to their own individual motivations to act and allows potential partners to make a personal connection, which is critical to sustaining volunteer commitments in this setting. The story of us further allows us to build empathetic connections and a collective capacity by describing our shared experiences and conditions. Sharing narratives about who we are collectively reminds everyone that they are not alone and that in joining together, they have the power to make a difference. Finally, the story of now allows leaders to discover common purpose and a motivating vision on which to act. Because leaders tell individual and collective stories to motivate others to join them in action, they are directional and purposeful. As one coalition leader stated, "It's not just telling a story for a story's sake. You are trying to accomplish something with it." In other words, narrative is a motivational call to action through which leaders describe the urgent challenges they face, a hopeful vision of what life could be, and the specific choices that others can make to move toward that vision right now. Take a moment now to watch this TED Talk video. Use the worksheet provided in this session's materials to keep notes. As you watch, think about her story of self. How did Nelson Mandela motivate her to action? How did she describe her personal values and emotions? What was her story of us? How did she describe how HIV affects us all? And what is her story of now and her call to action for all of us? You can pause the slides now and use the link that was provided with this session's materials to watch the video. Now that you've watched the video, think about what you learned. How do you feel? Did you want to stand with the audience? What will you do differently after watching this video? Inspiring leaders weave threads of narrative into almost everything that they do. They share their motivating visions in calls to action at meetings, to solicit resources for efforts, and to recruit team members to join coalition leadership. Coalition leaders reach out to community members they have never met and share narratives to invite them to one-to-one meetings or coalition discussions on health. As one leader remarked, "Once you engage in narrative, people open up and start talking and listening to one another. That builds the foundation or the glue that brings people together to do the work." As leaders share value-based stories with one another, they motivate each voluntary action that contributes to the whole. Narrative is the heartfelt and motivating introduction to why a coalition's work together is important. The three-part narrative is meant to be brief, not an hour-long lecture. Leaders prepare and practice narratives so they can be effectively and efficiently delivered in 5 minutes or less. Leaders learn to adapt their narrative for time allowed and also for the specific audience, the present moment, and the specific ask or call to action. Thank you for joining me today for this session. For more information, please feel free to reach out to me at the email address below.